See, the success of IVF depends upon various factors. For me, the most important factor is the patient's attitude. We should give hope to the patient. And secondly, IVF is a very process that is not a newer technology. Various advancement has been made in that. So whatever new technologies are there, that is going to improve the IVF success rate. So there are various technologies like the sperm selection techniques are there. There are microfluidics, Pixie, MAC. For endometrial receptivity, we have endometrial receptivity assay. We can improve the endometrium by PRP or improve the implantation by embryoglue. Then we have a better specialized stimulation protocol so that we can get the maximum egg yield. So these laser assisted hatching, cryopreservations, electronic witnessing system. So these are all technologies that has been there and recent advances has been made to improve the IVF success rate. Uh, as I said, IVF is not a one-day procedure. It's a journey which the patient takes from for the shackle of infertility that they have. So the patient is already have a societal pressure, family pressure, and personal insecurities among them. So it is very important that patient should be supported emotionally and mentally, because when the patient is emotionally prepared, then the outcome obviously increases when the patient enters with a positive attitude. So here comes the role of the psychological counselor, where he or she will be with the patient and guiding the couple at every step and giving them the hope. So it's very important that a counselor should be present at every IVF center so that the patient have the mental support and emotional support, and that will ultimately lead to improvement in their IVF outcome. The IVF is a very IVF success rate also depends upon the patient factor. So there are various cases where the success rates, we already tell patient that the success rate is good because they have good eggs, they have good factors which are like tubal factors. So here the IVF success rate is good if the patient is young. But then there are scenarios like adenomyotic uterus, there is endometriosis, with the patient have pelvic adhesions, inflammations, or the patient is an advanced maternal age with low ovarian reserve, or the patient have a very poor sperm morphology. So these are the cases where we need a customized approach. One size fit will not do work here, and here we have to be customized to the patient, and how we have to focus that how we can improve the success rate in these cases. So these are the cases where we have to put a more effort to that. IVF is surrounded with many myths, and these are one of the reasons IVF patients delay IVF treatment, because there are taboos associated with it. The main taboo that the patient feel that IVF is the last option. When I'll reach 35, 40, then I will opt for IVF. But it's not that. Yes, IVF patient do opt for IVF when they are not able to conceive naturally for a long time because it has a better success rate. But for patients who are of advanced age, like more than 35, a very low egg reserve, patient with endometriosis, with tubal factors, patient with severe sperm, bad quality sperm, that patient should obviously go for IVF early. Secondly, they feel that IVF there is always a twin pregnancy, but that we have to discuss with your doctor that whether you want a single embryo transfer or a double embryo transfer. Twin pregnancy will happen only when we transfer double embryo. Thirdly, is that IVF is a process where we have to do a complete bed rest. So that is also a myth, because after IVF embryo transfer, you can follow your routine activity, you can go on your job. Just you have to take care that you have to avoid jerky travels. And lastly, I would say that IVF people consider it as a very costly procedure, but it is a cost effective procedure, because suppose a patient is suffering from infertility for last 10 years and is already taking medications, treatment, so it all cost adds equally. So it's not a costly procedure, it's a cost effective treatment. So these are some of the common myths that are associated with IVF, and it is better that we talk more about IVF to break these myths. IVF, before entering into the IVF, I would advise everybody to do a thorough research on their own part also, if possible, because success rate of IVF depends upon two factors. One is the patient factor, like how and how early the patient is entering, and second is the IVF center where they're getting the treatment done. So a good IVF center should have a ethical practice, good clinical practice, and should have an experienced team of doctors and embryologists. The lab should have high standard with good quality, air quality, quality check. They should have recent advanced technologies available at the center, so that if the patient is needed these advanced recent advances, that that facility is provided. Apart from that, they should be guided and psychological support should be given by the center at every step. They should be guided that what you are going to see in the future. And lastly, the IVF center should be very transparent in their financial counseling, that how much financial uh, burden or what financial cost the patient will bear, so that the patient can prepare themselves mentally, emotionally, and financially well before entering into the IVF procedure. Thank you. Thank you.